Grower Pesticide Safety Course, Chapter 9, Pesticide Poisonings. Chapter 9 starts on page 103 of the manual. There are about 17 slides on this presentation, and it will take us about 10 minutes to review. What will I learn? By the end of this lesson, you should be ready to explain the 4 ways that pesticides can enter the body, routes of exposure, list ways to prevent pesticide poisonings, list symptoms of pesticide poisonings, and state when to ask your doctor for cholinesterase testing. Pesticide poisonings can happen. Poisonings often involve young children. Remember that all pesticide products, even the ones you use around your home, can cause poisoning. Take precautions to protect yourself and others from exposure to pesticides. Routes of exposures. Pesticides can enter your bodies in 4 ways. Mouth, oral exposure, swallowing, ingesting. Lungs, inhalation exposure, respiratory, breathing exposure. Through the skin, dermal exposure, absorbing, and through the eyes, ocular exposure, absorbing. Mouth, oral exposure. This is what happens when you may swallow or ingest the pesticide. Your mouth, stomach, and intestines will absorb pesticides very quickly. Pesticides could enter your body through your mouth if you wipe your mouth on the sleeve, or your glove comes up to your face, to your mouth, accidentally drink leftover pesticides that are stored in a drink or food container, such as a water bottle. And this has happened before, most recently out west a few years ago. Someone had stored leftover pesticide in a food container. If you're smoking or eating during or after using a pesticide or before washing. Also, if you eat food that was recently treated with pesticides and you haven't waited till the harvest period, and that could be a problem. And then if you splash pesticides into your mouth when you're using pesticides. So you want to prevent exposure through your mouth. So don't store leftover pesticides in food or drink containers. Don't use your mouth to siphon pesticide liquids or to clean nozzles. Wash before you eat or drink. And use a face shield to protect your face from splashes. Lungs, inhalation exposure. So once pesticides reach the lungs, they are absorbed easily since the surface of the lung is a very thin membrane. You have a greater chance of inhaling pesticides when you work in enclosed spaces such as greenhouses, mushroom houses, barns, or with fumigants, suspensions in air, or volatile pesticides. So then, the best way to prevent exposure to your lungs, wear a respirator. Choose the right one for the job and make sure that it fits, clean, and maintain it. And there's more information in the protective clothing and equipment section for picking the right respirator. Skin and eyes, dermal and ocular exposure. And this is the most common type of exposure. And we have a gentleman here, and the most exposed, often areas that get exposed would be the arms and the forearms. Your body will absorb pesticides more easily when your skin has cuts or scrapes, your skin is moist or sweating, and your pores are open to let pesticide in. And the pesticide is a type that enters skin easily, and there are some that may enter the skin more easily. So again, check the label, the precaution statements to see if this is the case with the pesticide you're using. The longer the pesticide stays on your skin, of course, the more likely it has a chance to enter through the skin. So again, as soon as you're finished, make sure you do a complete wash of your skin after you use pesticides. Prevent exposure to your eyes. Eyes absorb pesticides quickly. The special warnings for eye hazards will be on that front part of that pesticide label, so look for those. But wear goggles or a face shield to protect your eyes. Prevent exposures to your skin and eyes. Wear clean clothes every day. Keep plenty of gloves available. Wash your hands before you use the toilet, before you eat, before you drink or smoke if you're working. And shower right away if you spill pesticide on yourself. Keep all equipment clean and in good repair. Restricted entry intervals. Another good way to prevent exposure, and we've mentioned these on other chapters, but do not enter or allow workers to enter into treated areas during restricted entry intervals. Tell workers and others of the restricted entry intervals. One way to do this is to post signs, such as the example shown, at any of the main ways into treated area. Keep information about each application in a central location where the information can be readily read by workers. If you'd like to get a copy of those signs, please contact our office, the Ontario Pesticide Education Program office. We have those available. Question: it's hot, humid day, and you are working with pesticides. These weather conditions increase your risk for what type of exposure? Through the mouth, through the skin, or through the lungs? It's a hot, humid day. If you mention skin, that would be the correct answer. Sweaty skin absorbs pesticide easily. You may wipe your face with your sleeve or glove, again exposing your skin area. Learn the symptoms of pesticide poisoning so you're ready to react if one happens. Mild, moderate, and severe symptoms may happen. Mild symptoms sometimes are symptoms of the flu or heat exhaustion, so be aware it could be from a pesticide or it could be from just a hot day. Moderate symptoms and then severe symptoms. Mild symptoms can quickly get worse, so get medical help. Cholinesterase inhibitors. There's two types of insecticides that affect the cholinesterase level in your blood, and those chemical groups, one group is the organophosphates and the other group are the carbamates. Organophosphates, things like lorsban, diazinon, malathion, and carbamates, carbaryl, and methylmalate. If you use these types of insecticides, you can ask your doctor for a blood test to monitor your exposure. Organophosphates and carbamates, ask your doctor to monitor your exposure. You can do this. It's not a regular routine blood test. You must ask for it. If the blood tests show a lower cholinesterase level, stop working with the insecticides until your level returns to your baseline normal level. Get a baseline blood test first. So before you handle these types of pesticides, go in and get tested. And then get blood tests at intervals during the spray season as you're using these products. Check your handling procedures and protective equipment. You should not be getting exposed. Don't handle again until your cholinesterase level is back to normal if you find that it has been lowered at your interval tests. Whenever you visit your doctor, tell your doctor that you work with pesticides. Maybe your symptoms or your illness would be related to your work. Always a good thing to do.